81. What is the best nursing intervention when caring for a patient with a newly placed chest tube? A. Encourage the patient to cough and deep breathe frequently. B. Remove the chest tube as soon as the patient complains of pain. C. Keep the chest tube clamped at all times. D. Encourage the patient to stay in a supine position. Answer. A. Encourage the patient to cough and deep breathe frequently. Rationale. Coughing and deep breathing help to expand the lungs and prevent complications such as pneumonia. 82. A nurse is caring for a patient who is receiving an intravenous, infusion. What should the nurse do if the site becomes red and swollen? A. Increase the flow rate of the B. Notify the healthcare provider and discontinue the C. Continue the infusion and monitor closely. D. Apply cold compresses to the site. Answer. B. Notify the healthcare provider and discontinue the Rationale. Redness and swelling at the site may indicate infiltration or infection, requiring immediate action to prevent complications. 83. When planning care for a patient with a chronic illness, which of the following is the most important factor for the nurse to consider? A. The patient's ability to follow prescribed medication regimens. B. The patient's family history of similar conditions. C. The patient's cultural beliefs and values. D. The patient's social network and support system. Answer. D. The patient's social network and support system. Rationale. A strong social network and support system are crucial for managing chronic illness and improving patient outcomes. 84. A patient is being discharged after a stroke. What should the nurse prioritize when developing a discharge plan? A. Scheduling follow-up appointments with the healthcare provider. B. Instructing the patient to rest for several weeks after discharge. C. Ensuring the patient understands the importance of physical therapy and rehabilitation. D. Teaching the patient how to manage their medications. Answer. C. Ensuring the patient understands the importance of physical therapy and rehabilitation. Rationale. Rehabilitation is critical for stroke recovery and improving the patient's functional outcomes after discharge. 85. In what situation would the nurse use an evidence-based approach in patient care? A. When the nurse's experience dictates a specific intervention. B. When the nurse has researched and found the best practices for the patient's condition. C. When the patient prefers a specific treatment. D. When the nurse is following routine protocols without considering patient specifics. Answer. B. When the nurse has researched and found the best practices for the patient's condition. Rationale. Evidence-based practice ensures that patient care is grounded in the most current and best available research. 86. Which of the following is a key characteristic of a nurse's role in patient advocacy? A. Making decisions for the patient to avoid confusion. B. Providing all necessary information to the patient to make informed choices. C. Ignoring the patient's wishes if they conflict with the treatment plan. D. Promoting the healthcare system's priorities over the patient's needs. Answer. B. Providing all necessary information to the patient to make informed choices. Rationale. Patient advocacy involves supporting the patient's right to make informed decisions about their care. 87. A nurse is caring for a patient who is experiencing an allergic reaction. What should be the first action? A. Administer the prescribed antihistamine. B. Notify the healthcare provider. C. Assess the patient's airway, breathing, and circulation. D. Monitor the patient for any further reactions. Answer. C. Assess the patient's airway, breathing, and circulation. Rationale. Ensuring the patient's airway and vital signs are stable is the priority in any allergic reaction to avoid life-threatening complications. 88. In the nursing process, what is the primary purpose of the assessment phase? A. To create a plan of care based on the nurse's intuition. B. To identify and analyze the patient's problems or health status. C. To implement interventions that improve patient health. D. To evaluate the success of the interventions. Answer. B. To identify and analyze the patient's problems or health status. Rationale. Assessment is the first step in the nursing process, where data is gathered to identify patient needs and concerns. 89. Which of the following is an example of primary prevention in nursing? A. Administering a flu vaccine to a healthy individual. B. Providing wound care for a patient with a pressure ulcer. C. Offering rehabilitation services after a stroke. D. Providing palliative care for a terminally ill patient. Answer: A. Administering a flu vaccine to a healthy individual. Rationale: primary prevention focuses on preventing disease before it occurs, such as through immunizations. 90. A nurse is preparing to administer a medication that could cause a significant drop in blood pressure. What is the most important action the nurse should take? A. Administer the medication slowly and monitor the blood pressure frequently. B. Provide the medication at a higher dose to speed up its effect. C. Skip the medication and consult the physician immediately. D. Administer the medication and monitor the heart rate only. Answer: A. Administer the medication slowly and monitor the blood pressure frequently. Rationale: slow administration and close monitoring are essential to prevent severe hypotension in response to the medication. 91. A nurse is caring for a patient who has just undergone surgery. What is the first step in assessing the patient's pain level? A. Ask the patient to rate their pain on a scale of 0 to 10. B. Observe the patient's facial expressions and body language. C. Administer the prescribed pain medication. D. Wait for the patient to express discomfort. Answer: A. Ask the patient to rate their pain on a scale of 0 to 10. Rationale: using a standardized pain scale allows the nurse to assess and document the patient's pain level objectively. 92. What is the most important factor to consider when prioritizing nursing interventions? A. The nurse's personal preferences for certain tasks. B. The severity of the patient's symptoms and the risk to their health. C. The amount of time available to complete the tasks. D. The patient's ability to perform self-care independently. Answer: B. The severity of the patient's symptoms and the risk to their health. Rationale: prioritization should be based on the severity of the patient's condition and the potential risks involved. 93. What is the best intervention for a patient who is experiencing difficulty breathing and is anxious? A. Place the patient in a supine position to ease breathing. B. Provide reassurance and encourage slow, deep breathing. C. Administer oxygen and avoid any verbal interaction. D. Keep the patient in a sitting position and administer sedatives. Answer: B. Provide reassurance and encourage slow, deep breathing. Rationale: reassuring the patient and guiding them in slow, deep breathing helps reduce anxiety and facilitates better oxygenation. 94. A nurse is educating a patient with hypertension about lifestyle changes. What is the most important dietary modification to discuss? A. Increase sodium intake to maintain blood pressure. B. Reduce the intake of processed foods and salt. C. Limit fluid intake to reduce swelling. D. Increase the intake of high-fat foods for better energy. Answer: B. Reduce the intake of processed foods and salt. Rationale: reducing salt and processed foods can help lower blood pressure in hypertensive patients. 95. Which action by the nurse demonstrates effective time management in a busy clinical environment? A. Completing the most complex tasks first to get them out of the way. B. Prioritizing patient care based on urgency and importance. C. Avoiding delegation to others and handling all tasks independently. D. Ignoring non-urgent tasks to focus solely on immediate concerns. Answer: B. Prioritizing patient care based on urgency and importance. Rationale: effective time management involves prioritizing tasks to ensure that urgent and important patient needs are met first. 96. What is the primary goal of patient-centered care? A. To achieve the best clinical outcomes regardless of the patient's preferences. B. To involve patients in decisions about their health care and respect their preferences. C. To focus on the healthcare team's goals and efficiency. D. To adhere strictly to institutional policies and protocols. Answer: B. To involve patients in decisions about their health care and respect their preferences. Rationale: Patient-centered care emphasizes the importance of respecting the patient's values, preferences, and individual needs in the decision-making process. 97. A nurse is caring for a patient with a history of alcohol abuse. What is the most important aspect of the patient's care plan? A. Focus solely on detoxification and discharge. B. Include strategies to help the patient avoid relapse and manage cravings. C. Provide medications to cure alcohol addiction. D. Ignore the patient's alcohol history and focus on their immediate medical needs. Answer. B. Include strategies to help the patient avoid relapse and manage cravings. Rationale. A comprehensive care plan for an alcohol-abusing patient should address both detoxification and long-term strategies to prevent relapse. 98. A nurse is caring for a patient who has undergone a laparotomy. What is the most important intervention to prevent postoperative complications? A. Encourage deep breathing and coughing exercises. B. Keep the patient NPO, nothing by mouth, for 24 hours. C. Administer pain medications to keep the patient comfortable. D. Position the patient in a side-lying position at all times. Answer. A. Encourage deep breathing and coughing exercises. Rationale. Deep breathing and coughing exercises help prevent atelectasis and pneumonia, which are common postoperative complications. 99. What is the primary role of the nurse when providing discharge teaching for a patient with a new diagnosis? A. To provide all the necessary information without considering the patient's readiness to learn. B. To ensure that the patient fully understands the diagnosis and plan of care before leaving the hospital. C. To encourage the patient to leave the hospital quickly to make room for other patients. D. To focus on the patient's emotional reactions to the diagnosis rather than practical information. Answer. B. To ensure that the patient fully understands the diagnosis and plan of care before leaving the hospital. Rationale. Discharge teaching is crucial for patient self-care and adherence to the treatment plan after discharge. 100. What is the best strategy for a nurse to use when providing culturally sensitive care? A. Assume that all patients from the same culture have the same healthcare beliefs and practices. B. Ask open-ended questions to learn about the patient's cultural background and preferences. C. Rely on family members to explain cultural preferences on behalf of the patient. D. Focus on the nurse's cultural background to guide the care process. Answer. B. Ask open-ended questions to learn about the patient's cultural background and preferences. Rationale. Culturally sensitive care involves understanding and respecting each patient's unique cultural beliefs and practices. 101. A patient with a history of asthma asks the nurse about using a nebulizer. What is the nurse's best response? A. You should only use the nebulizer when you are experiencing severe symptoms. B. You should use the nebulizer as prescribed, even if you are not feeling symptoms. C. The nebulizer should be used only if other treatments are ineffective. D. Nebulizers should never be used during an asthma attack. Answer. B. You should use the nebulizer as prescribed, even if you are not feeling symptoms. Rationale. Nebulizers should be used as prescribed to help control asthma symptoms and prevent exacerbations. 102. A nurse is caring for a patient who is recovering from surgery. The patient is showing signs of confusion and agitation. What is the nurse's first priority? A. Provide the patient with sedatives to calm them down. B. Call the healthcare provider to discuss the symptoms. C. Check the patient's oxygen saturation and vital signs. D. Leave the patient alone to rest and recover. Answer. C. Check the patient's oxygen saturation and vital signs. Rationale. Confusion and agitation can be signs of oxygen deprivation or other medical issues, so assessing vital signs is crucial. 103. What is the primary goal of patient education regarding medications? A. To ensure the patient knows how to self-administer the medication. B. To teach the patient about the potential side effects and complications. C. To ensure that the patient can recall the dosage and schedule. D. To help the patient understand the purpose and benefits of the medication. Answer. D. To help the patient understand the purpose and benefits of the medication. Rationale. Understanding the purpose and benefits of medication increases patient adherence and promotes better outcomes. 104. A nurse is caring for a patient who is at risk for falls. What is the most important action to take? A. Place the patient on a soft mattress to prevent injury. B. Use fall precautions, such as keeping the bed in a low position. C. Administer a sedative to ensure the patient stays in bed. D. Monitor the patient only when they are awake and alert. Answer. B. Use fall precautions, such as keeping the bed in a low position. Rationale. Fall precautions are key to preventing injury in high-risk patients, such as adjusting the bed height and keeping the environment clear of obstacles. 105. A nurse is preparing a patient for discharge after a myocardial infarction. What is the most important teaching point? A. Limit physical activity for the first month after discharge. B. Avoid taking any prescribed medications to prevent side effects. C. Follow-up appointments with the healthcare provider are essential. D. Discontinue all medications as soon as you feel better. Answer. C. Follow-up appointments with the healthcare provider are essential. Rationale. Follow-up care is critical after a myocardial infarction to monitor progress and adjust treatment as needed. 106. A nurse is caring for a patient with a wound infection. What should the nurse do first? A. Administer antibiotics as ordered. B. Apply a sterile dressing to the wound. C. Notify the healthcare provider about the infection. D. Assess the wound for signs of infection and report findings. Answer. D. Assess the wound for signs of infection and report findings. Rationale. Proper assessment helps determine the severity of the infection and informs appropriate interventions. 107. A nurse is caring for a patient with severe dehydration. What is the most important priority for the nurse? A. Administer intravenous fluids as prescribed. B. Provide oral hydration with electrolyte solutions. C. Ensure the patient is in a comfortable position. D. Give the patient high-calorie foods immediately. Answer. A. Administer intravenous fluids as prescribed. Rationale. Intravenous fluids are the quickest and most effective way to treat severe dehydration. 108. What is the primary reason for a nurse to use therapeutic communication techniques when caring for patients? A. To gather information needed for the care plan. B. To establish a trusting relationship and promote patient comfort. C. To educate the patient about the treatment plan. D. To clarify medical terminology for the patient. Answer. B. To establish a trusting relationship and promote patient comfort. Rationale. Therapeutic communication builds trust, which is essential for effective patient care and promoting positive health outcomes. 109. Which of the following is an example of a nurse demonstrating cultural competence? A. Assuming that all patients from the same culture share similar beliefs. B. Asking patients about their cultural preferences regarding healthcare. C. Ignoring cultural differences to provide the same care to everyone. D. Providing care based solely on your own cultural values. Answer. B. Asking patients about their cultural preferences regarding healthcare. Rationale. Cultural competence involves understanding and respecting each patient's unique cultural needs and preferences. 110. When assessing a patient's pain, which of the following is the most important to evaluate? A. The patient's vital signs. B. The patient's self-reported pain level. C. The patient's history of pain medication use. D. The patient's family history of pain disorders. Answer. B. The patient's self-reported pain level. Rationale. Pain is a subjective experience, and the patient's self-reported pain level is the most accurate indicator of their discomfort. 111. A nurse is caring for a patient with a wound that is healing slowly. What is the most important factor to assess? A. The patient's nutritional status. B. The patient's pain level. C. The patient's emotional state. D. The patient's ability to perform activities of daily living. Answer. A. The patient's nutritional status. Rationale. Proper nutrition is essential for wound healing, as it provides the necessary nutrients to support tissue repair. 112. What is the most important aspect of maintaining a safe environment for patients in a healthcare facility? A. Regular cleaning and disinfecting of surfaces. B. Ensuring that all staff members are properly trained in safety protocols. C. Keeping the patient's room temperature comfortable. D. Making sure the patient has access to entertainment and distractions. Answer. B. Ensuring that all staff members are properly trained in safety protocols. Rationale. Training staff in safety protocols helps prevent accidents and ensures that all safety measures are consistently followed. 113. Which action is most important when caring for a patient with a chest tube? A. Keeping the chest tube clamp in place at all times. B. Ensuring that the chest tube is properly secured and functioning. C. Administering pain medications frequently. D. Restricting the patient's movement to avoid dislodging the tube. Answer. B. Ensuring that the chest tube is properly secured and functioning. Rationale. The chest tube must be monitored to ensure it is properly draining and that there are no leaks or complications. 114. What is the most important nursing action when caring for a patient with a urinary catheter? A. Ensuring the catheter is securely fastened to prevent dislodgement. B. Changing the catheter every 24 hours to prevent infection. C. Ensuring that the catheter bag is kept below the level of the bladder. D. Restricting fluid intake to prevent overhydration. Answer. C. Ensuring that the catheter bag is kept below the level of the bladder. Rationale. Keeping the catheter bag below the bladder helps prevent backflow of urine, which can lead to infection. 115. What is the primary goal when providing care for a patient with a chronic illness? A. To cure the illness completely. B. To manage symptoms and improve quality of life. C. To provide comfort and avoid any further complications. D. To encourage the patient to stop treatment as soon as they feel better. Answer. B. To manage symptoms and improve quality of life. Rationale. Chronic illness management focuses on symptom control, preventing complications, and enhancing quality of life. 116. A nurse is preparing to administer an intramuscular injection. Which action is most important to ensure patient safety? A. Select the appropriate site for injection based on patient factors. B. Cleanse the site with alcohol and allow it to dry before injection. C. Use a needle that is the shortest available for the injection. D. Avoid any conversation with the patient during the procedure. Answer. A. Select the appropriate site for injection based on patient factors. Rationale. Selecting the correct injection site based on the patient's anatomy and condition ensures safe and effective delivery of medication. 117. Which of the following is an important aspect of a nurse's role when providing end-of-life care? A. Focus only on pain management and avoid discussing the patient's emotional needs. B. Support the patient's and family's emotional, spiritual, and physical needs. C. Encourage the patient to stop discussing their concerns. D. Continue all treatments to prolong life, regardless of the patient's wishes. Answer. B. Support the patient's and family's emotional, spiritual, and physical needs. Rationale. End-of-life care addresses all aspects of the patient's well-being, including emotional and spiritual needs. 118. Which intervention is most important when caring for a patient with a surgical wound? A. Applying heat to the wound to promote healing. B. Ensuring the wound is kept clean and dry. C. Limiting the patient's movement to prevent strain on the wound. D. Changing the dressing as frequently as possible. Answer. B. Ensuring the wound is kept clean and dry. Rationale. Proper wound care, including cleanliness and dryness, reduces the risk of infection and promotes healing. 119. What is the primary consideration when caring for a patient with a history of anxiety? A. Provide clear and direct instructions without any room for interpretation. B. Encourage the patient to face their fears directly without support. C. Offer reassurance and a calm environment to reduce anxiety. D. Limit communication to avoid overwhelming the patient. Answer. C. Offer reassurance and a calm environment to reduce anxiety. Rationale. A calm and reassuring approach helps patients manage anxiety and feel safe in their care environment. 120. What is the first priority when caring for a patient who has suffered a stroke? A. Administer thrombolytic therapy as soon as possible. B. Obtain a complete history of the patient's symptoms. C. Monitor the patient's vital signs closely. D. Begin rehabilitation exercises immediately. Answer: A. Administer thrombolytic therapy as soon as possible. Rationale: thrombolytic therapy is most effective when administered early in the stroke to break up the clot and reduce brain damage.